Welcome to the NCLEX Bootcamp series on the Next Generation NCLEX. In this video, we'll show you a strategy for approaching next-gen cases. We'll look at the steps in the clinical judgment model, show you how to prioritize, and then walk you through the client data tabs and each of the 6 steps in every next-gen case. So first, the clinical judgment measurement model. To review this from our first video, this is a 6-step process outlining how a nurse thinks. And every next-gen case is 6 questions long where each question corresponds to one of these 6 steps. First, you're going to recognize cues or decide which of those client findings is most important. Then you'll analyze what those cues could mean. You'll prioritize hypotheses or decide what the priority problem is that you need to address first. You'll then generate solutions or decide what actions you can take to address that priority problem. You'll actually take those actions and finally evaluate the outcome to determine, did it help? We're going to first talk about prioritization because you can't have a discussion about next-gen NCLEX or about nursing without talking about prioritization. You're always going to have more things to do than you have time to do them, and so constantly in practice and on the test, you're going to be asked, which client do I see first? Which action do I take first? Which medication first? So you've probably heard many different frameworks for how to approach prioritization, like Maslow's hierarchy of needs and your ABCs. I like to keep it simple and really consider what are those highest priority actions compared to my medium and my lower priority actions. So your highest priority issues are always going to be life-threatening issues of airway, breathing, or circulation, or anything that has the potential to become a life-threatening issue of airway, breathing, or circulation. I think we can all pretty easily identify what an airway issue is. Maybe someone has an inhalation injury and they have airway edema, they've aspirated, you have a child with epiglottitis and they're closing off. Maybe a breathing issue where you have bronchospasm and asthma or pulmonary edema and CHF. Anything that's going to impair your exchange of oxygen and carbon dioxide could be a breathing issue. And then circulation, not just overall circulation with blood pressure and heart rate issues, but also any peripheral circulation like perfusion to a limb or an organ. And then we also have those things that don't look like issues of airway, breathing, or circulation on the surface, but have the potential to very rapidly progress to a life-threatening issue if they remain untreated. So one example might be if you have a child with appendicitis. They're stable 1 minute and then the next they have signs of appendix rupture. So they have a board-like abdomen, a really high fever, a really, really tender abdomen to where you can barely touch them. What's happened is they've spilled bacteria into their sterile peritoneal space, and if you don't do something immediately, they're rapidly becoming septic and their blood pressure is going to drop and they're going to lose perfusion to their vital organs. So you wouldn't necessarily say that a ruptured appendix is an issue of airway, breathing, or circulation, but if you don't do something about it first, it will quickly become one. Then you have your medium priority actions. These are most actions that we do as nurses. These are your scheduled routine tasks like giving medications, repositioning your clients. These are important actions, but they're not as emergent or as time sensitive as high priority actions. No one is going to get hurt if you delay these things. And then finally, your lower priority actions. These are those things that can be delayed, delegated, or skipped altogether. One example might be providing client discharge teaching. Obviously, if that client is stable enough to go home, they're waiting on you, and that does have a sense of urgency to it, but ultimately, you're not going to have client harm if that's delayed. So when you're asked to prioritize anything, always keep in mind, what is that one thing? If I'm going to do one thing and then walk away from that client and do nothing else, that's always going to be your priority action. And we're going to have plenty of examples to look at both here and in our question bank. So the first thing you see when you open a next-gen case is your client data tabs on the left, and then your questions on the right, where you'll progress through each of your 6 items. And here, this case has nurse's notes, history and physical, and vital signs available to you, but really you can see anything here that you would see in a medical record. So that could be laboratory results, diagnostic, intake and output flowchart, or really anything that's going to help you make that decision for how to answer each of these questions. And this is really the major difference, I feel, between conventional NCLEX questions and the new next-gen questions, is now you have to keep a lot more information in mind when you're responding to these questions. So the first thing I recommend that everyone do is to read and envision this scenario closely. There's going to be a lot going on, and it's easy to get distracted or to lose track of details. And so if you can keep a mental picture of this client in your mind as you progress through the questions, that's going to help you prioritize and choose which actions to take. So for example, let's walk through this together, and I'm going to use my highlight function just to keep track of those findings that are abnormal or really stand out to me. So first, a 61-year-old client comes to the emergency department reporting shortness of breath. She states that she had to stop and sit down while getting ready for work this morning because she suddenly felt like she could not catch her breath. She denies any cough, fever, palpitations, or lightheadedness. She denies any recent sick contacts, but notes that she recently injured her leg in a minor bicycle accident. So already here, I want you to start keeping in mind, I have someone sitting in front of me who's short of breath. This hit her all of a sudden. She also has this leg injury that may or may not be important yet. Then for our history and physical, she's alert and oriented to person, place, and time. She's slightly anxious. We already know that she has dyspnea. We find that her lung sounds are diminished with fine crackles in the bilateral bases. She also has sharp chest pain on inspiration, and she denies cough. She's a former 10-year smoker and quit 25 years ago. We listen to her heart. She's got a regular rhythm. Her S1 and S2 are present with no murmurs. She's got 2+ peripheral pulses in bilateral upper and lower extremities, and she also has a history of hypertension. Her abdomen is soft and non-tender with bowel sounds normoactive times 4 quadrants. She has a healed transverse lower abdominal scar. She denies dysuria, and she is obese. She's postmenopausal. She takes oral hormone replacement therapy to help relieve her hot flashes, and she has a history of 2 C-sections, which might explain her lower abdominal scar. Her right lower leg has erythema, tenderness, and then 1+ pitting lower extremity edema extending to the thigh. She states, I hurt my leg when I wrecked my bicycle, and the pain and swelling are getting worse. She has a history of varicose veins. And then just some psychosocial context. She's married with 2 adult children and works long hours at a crowded call center as a telephone operator. So adding more to your scenario here, this mental picture of someone who's short of breath with a leg injury. She's also anxious. She has crackles in her lungs. Her lung sounds are diminished. When you look at her, her leg is edematous. It's tender. This goes all the way up to the thigh. So that's a pretty big leg compared to the other one. Keeping all this in mind as we go. And then for your vital signs, she's not febrile, but a little bit elevated at 99.9 Fahrenheit or 37.7 centigrade. She's tachycardic at 118 beats a minute. She's tachypnic at 24 breaths a minute. Her blood pressure's on the low side of normal at 108/56, and her pulse oximetry reading is 89% on room air. So in addition to these physical exam findings, we also now know her heart's going really fast, she's breathing very quickly, and she's not maintaining her oxygenation. So use this picture and keep this picture in mind as you progress through the case. I also like to consider at this point what the problem is. And don't get overly complicated with this. You're not being asked to make a formal diagnosis at any point in an next-gen case, but you just want to consider what's wrong. What's the big problem? And here, I would really say that I have 2. She can't breathe, and then she has this edematous lower extremity. That's enough, just keeping this in mind. And here I've used my highlight function. On the test, you're going to have a whiteboard where I would recommend just kind of writing down those problems quickly. Can't breathe, edema, extremity. So keeping that in mind, and then it's important to revisit that mental picture every time the scenario updates. So you'll see here that as I progress through the case, at some point, the scenario is going to unfold. You see here now I've got a new orders tab with some new information that's unfolded to me. Every time the scenario updates, you're going to be prompted with a header that kind of cues you to review your new updated findings. So here we're told the nurse reviews the new orders tab that we see here, and then the updated nurse's notes and vital signs from 6:45. So in addition to that information we already reviewed, we now have a new nurse's note entry and then a new set of vital signs taken at 6:45. So Anything can happen in this scenario. Your client can decompensate, they can go to surgery, maybe they're admitted from the emergency department to the med-surg floor. And you need to keep that in mind in your visual of this scenario because that might affect what resources are available to you or how you answer that question. So I would say that's the most important step, is really reviewing your client data tabs in a way that you have a clear picture of what's going on, because every step after that depends on your understanding of what's happening up front.